Define hemorrhage. Escape of blood from the vascular system to the exterior. Classify hemorrhage. Classification. According to presentation, revealed hemorrhage and concealed hemorrhage. Revealed hemorrhage is the obvious external hemorrhage. For example, exsanguination from an open arterial wound, or massive hematemesis from a duodenal ulcer. Concealed hemorrhage is contained within the body cavity. Again, concealed hemorrhage is of two types. 1. Traumatic concealed hemorrhage, and 2. Non-traumatic concealed hemorrhage. Example of traumatic concealed hemorrhage is traumatic hemorrhage within chest, abdomen, pelvis, retroperitoneum and limbs. Example of non-traumatic concealed hemorrhage is occult gastrointestinal hemorrhage due to ruptured aortic aneurysm. Clinical classification of hemorrhage. Clinically, hemorrhage is classified on the basis of time. According to time, hemorrhage is of three types. 1. Primary hemorrhage, 2. Reactionary hemorrhage, and 3. Secondary hemorrhage. Primary hemorrhage occurs immediately due to an injury or surgery. Reactionary hemorrhage is delayed hemorrhage occurring within 24 hours, commonly within first 4 to 6 hours after surgery. Causes of reactionary hemorrhage. Reactionary hemorrhage may occur due to 1. Dislodgment of blood clot by resuscitation. 2. Normalization of blood pressure. 3. Vasodilatation, due to cessation of reflex vasospasm. 4. Technical failure such as slippage of a ligature. 5. After coughing. 6. Increased mobility. Secondary hemorrhage occurs 7 to 14 days after injury. Secondary hemorrhage is precipitated by infection, pressure necrosis or malignancy.
Classification of hemorrhage, according to surgical management. According to surgical management, hemorrhage is of two types: surgical hemorrhage and non-surgical hemorrhage. Surgical hemorrhage occurs due to direct injury and amenable to surgical control. Non-surgical hemorrhage is generalized ooze from all raw surfaces due to coagulopathy and cannot be stopped by surgical means.
Classification of hemorrhage according to source of bleeding. According to source of bleeding, hemorrhage is of three types. 1. Arterial hemorrhage, 2. Venous hemorrhage, and 3. Capillary hemorrhage. Arterial hemorrhage is bright red in color, pulsating, and spurt in jet. Venous hemorrhage is dark red in color, steady, and copious. Capillary hemorrhage is bright red in color, continuous, and oozes from the surface.